What's the most common fracture at birth in newborns? Clavicle fracture. Most common site of clavicle fracture. Junction of medial 2/3 road and lateral 1/3 road. Displacing forces in clavicle fracture. Medial part pulls up, SCM. Lateral part, pushed down pectoralis, weight of arm. Complications of clavicle fracture and most common one. Malunion M.C. Neurovascular injury, brachial plexus, subclavian vessels. Conservative management of clavicle fracture. 1. Figure of 8 bandage. 2. Arm sling, arm pouch. 3. Combination of both. What's Velpo bandage and its indications? Clavicle fracture, acromion injuries, shoulder dislocation. Indications for surgery in clavicle fracture. 1. Open clavicle fracture. 2. Massive displacement with skin tenting plus. 3. Acromioclavicular joint involved. 4. Neurovascular injury. 5. Floating shoulder injury, clavicle plus glenoid fracture. What is the surgery for clavicle fracture? Or if open reduction internal fixation. Mobility and stability of shoulder joint. Head size is 4 times of socket glenoid, so high mobility, low stability. Weakest point and most common dislocation in shoulder joint. Weakest point, inferior, MC dislocation, and greater than post greater than inferior. Dynamic stabilizers of shoulder joint. Rotator cuff, tendon of long head biceps. Static stabilizers of shoulder joint and most important among them. Superior, middle, inferior. Glenohumeral ligament, inferior is most important. Rotator cuff muscles. Supraspinatus sup, infraspinatus INF. Subcapsularis and teres minor post. Subtype of anterior dislocation of shoulder joint. Preglenoid, subcoracoid MC. Subclavicular, intrathorax. Presentation of anterior shoulder dislocation. 1. Loss of shoulder contour flat. 2. Limb abducted and externally rotated. Examination findings in anterior shoulder dislocation. 1. Hamilton ruler test. 2. Dugas test. 3. Callaway test. 4. Bryant test. 5. Axillary nerve injury. Hamilton ruler test. Ruler placed against lateral epicondyle humerus, touches acromion, cus head of humerus displaced. Dugas test. Unable to touch opposite shoulder. Callaway test. Increased vertical axillary circumference. Bryant test. Anterior axillary fold, is lowered on dislocated side. Axillary nerve injury and ant shoulder dislocation findings. 1. Loss of motor function, deltoid, teres minor. 2. Loss of sensory function, regimental badge sign, paresthesia, tingling, numbness over lateral aspect of upper arm. Techniques of reduction of anterior shoulder dislocation. 1. Modified Coker's technique. 2. Stimson tech. 3. Hippocratic tekken. Which is the most common technique of reduction of anterior shoulder dislocation? Modified Coker's technique. Team, traction, external rotation, adduction, medial internal rotation. Stimson technique. Patient prone, heavy object tied to dislocated limb. Hang at edge of table. Reduction achieved, after reducing, out in arm sling. Hippocratic technique. Traction with arm, counter traction with foot. Complications of recurrent anterior shoulder dislocation. 1. Bankart lesion MC. 2. Hill-Sachs lesion. What's Bankart lesion? Glenoid labrum tears anterio-inferiorly. Laxity of inferior glenohumeral ligament. Decreased stability. Recurrent shoulder dislocation. What's Hill-Sachs lesion? Due to recurrent dislocation, head of humerus repeatedly hits anterior glenoid rim, so indentation on posterior lateral surface of humerus are seen. Most common complications of shoulder dislocation. Recurrent dislocation. Most common early complications of shoulder dislocation. Axillary nerve injury. Posterior shoulder dislocation mechanism of injury. High-velocity muscular violence. In seizure. High-voltage electric shock. In electroconvulsive therapy. Presentation of patient with posterior shoulder dislocation. Shoulder contour not lost. Limb adducted and internally rotated. X-ray of patient with posterior shoulder dislocation. Electric light bulb sign. Complications of posterior shoulder dislocation. 1. Reverse Bencart lesion, postero-inferior tear of glenoid. 2. Reverse Hill-Sachs lesion, anteromedial indentation on head of humerus. 3. Axillary nerve injury. Inferior shoulder dislocation aka and mechanism of injury. Luxatio erecta. Mechanism, hyperabduction injury. Tests for anterior shoulder instability. Fulcrum, crank, apprehension. Tests for posterior shoulder instability. Jerk. Tests for inferior shoulder instability. Sulcus.